So I don't routinely use a gonioscope during the implantation. That again is surgeon dependent. I don't think one is better than the other, but I just think it works well for me. I just have to pay attention that I don't go too low, because you always have the tendency to be lower than you think. And when I was trained, my trainer told me, aim for the trabeculum, and once you think you're at the trabeculum, then just go a bit higher, because you're probably just below. Okay, so we're approaching, and while I approach the angle, again I might make little sidewise movement, gentle movements, and that is to ensure that I feel, as soon as I touch the angle, I will feel it. So now I feel I touch the angle. And once I'm going through the sclera, then I make little rotational movements with my inserter, because then it slides in more easily, and you don't have to put too much tension on your or give too much counter traction with your side instrument, so you don't get a lot of deformation of the cornea. So I'm actually moving forward slowly. You see, I don't do things over hastily. The surgery is short enough. You don't need to hurry up. So what I see now is that my needle is about to come out of the sclera, and it will come out right between my two dots, or just a little bit before, which is perfect. So also when I come out with the needle, I slow down, because I don't want it to come out very brusquely. Otherwise you risk that you perforate the conjunctiva. I keep going forward until the entire bevel of the needle is out. So this is the case now, and you see that the bevel of the needle is exactly between my two dots, so at 3 millimeters. Then I turn the tip of the needle towards the 12 o'clock position. And now I'm ready to start injecting. Now I very slowly inject the device. You see it coming out like a little yellowish worm. And then when the implant is out, I feel a little bit of a resistance in my finger. So I know that now the needle will start retracting. At that point I take a pause. I zoom out. I refocus my attention. Now I stop looking at the tip of the needle, but I focus on the angle, at the limbus, because that's where it's happening now. Now I make sure that I'm completely relaxed. You see that there is still some tension on the cornea. Well, I want to release that tension. See? I release the tension on my side instrument. Rinse, please. Okay. And I make sure that also on the inserter there is no tension. I have to be completely relaxed. And I always tell my fellows, this is the Zen moment. You have to become Zen when you do an XEN. So now I'm going to proceed with the retraction of the needle. So I move the slider forward further, and I make sure that I keep the inserter in the angle. I don't retract the inserter at this point. The instrument does that for you. Now the slider is completely forward. You see, I have had no movement, and only now I will retract slowly. There we are. And in this way, you don't get the so-called flicks that may actually pull your implant towards the anterior chamber, and then it's too long. And you don't damage the angle, which may cause bleeding. So you see that the implant is just above the trabecular meshwork, and that's exactly where you want it. You don't want to go right through trabecular meshwork, because then you're going through Schlemm's canal as well, and you may get reflux of blood. So you have less risk of bleeding if you place it just above.